Hello, everyone. It is my pleasure to be here today. For the past couple of days and today as well, I've met so many amazing people and panelists. For those whom we haven't met, and for those who are online, my name is Joy. I'm a PhD student in epidemiology at McGill University. Today, I'm interested in sharing with you some work that I've been involved in which I am interested in answering this question. Is exposure to high outdoor temperature a risk factor to child mental health problems in the urban tropics? So I hope we're all already on the same page, and by now that climate change is happening and that the world is warming. We're projected to exceed the Paris Agreement's 1.5 degrees Celsius threshold by 2040, which, when you think about it, it is just 15 years from now. And what accompanies these increased temperatures are increased frequency, duration, and severity of heat events that put human health, well-being, and livelihood at risk. But the world is not warming equally. Temperatures are already high across Africa and are projected to be even higher from global warming. The continent in general is already warming at a faster pace than the global average. And cities tend to be hotter than the surrounding rural areas, as there's a higher density of heat-trapping buildings and roadways relative to natural landscapes that can offer cooling. While children contribute the least to climate change, they are at a much greater risk of heat stress, especially in the midst of rising heat. They are a particularly vulnerable group of population because their thermoregulatory systems are not yet fully developed. They are also at a much limited capacity to adapt or avoid heat. Here, the photo shown here, and as what you have seen also before, is that here a mother brings her daughter to an urban hospital in Bangladesh as she noticed that her daughter has stopped eating and playing during extreme heat. But while the evidence around heat's impacts on physical health is clear, we know considerably less about its impacts on mental health. And it's particularly important to study mental health in children because the signs of mental disorders often first emerge in childhood. Without timely intervention, mental health conditions would likely exacerbate, worsen, and carry on into adulthood. In research concerning population mental health, we researchers would try to identify factors that may be amenable to interventions in order to mitigate mental health burden. And so therefore, this brings me to asking this question: is exposure to high outdoor temperature a risk factor to child mental health problems in Accra, Ghana? Accra is a prime and important location to study this very question because it is a tropical city located in Ghana, and it's also a rapidly urbanizing city in West Africa. Another reason that Accra is a prime location to study this very question is because we have a research study called the Accra School Health and Environment Study established by our research collaborators at the University of Massachusetts that gave us the data that is very much needed in order to answer this question. So this study is a cross-sectional study that is established to examine environmental conditions, including temperature and child health in Accra. The participant sampling process involved first a purposeful selection of 100 primary schools And then in each school, we will randomly select one to two students from each grade level. So that in the end, about 1,000 children were enrolled into the study along with their primary caregivers. So to get at its temperature, we set up an environmental monitoring campaign across the city in which we would measure temperature every hour in the outdoors at 140 sites across the city for about a year using these tiny sensors about the size of a coin. And then to get at the temperature that these children would be exposed to, I would then apply inverse distance weighting to estimate their exposure at their home address. To assess child mental health, we administered the Strengths and Difficulties questionnaire. It's a structured or closed-form questionnaire in which we would ask each caregiver whether 25 psychobehavioral attributes apply to their child over the past 6 months. These attributes can then group into the following domains as listed here. With emotional symptoms and peer relationship problems can be grouped to yield an internalizing problem score. For conduct problems and hyperactivity and inattention can then be grouped into an externalizing problem score. And finally, the internalizing and externalizing problem score can be summed up to yield a total difficulty score in which a higher score would indicate more child mental health related difficulties. We also collected and compiled information of various covariates at both the neighborhood and individual levels in order to better determine the relationship between outdoor temperature and child mental health, as this particular relationship can be quite confounded. So to investigate this very relationship, I employ skew normal mixed effects regression models under the Bayesian framework. What these big words mean is that, for one, the skew normal part of these models can better model skewness in child mental health outcomes. So the total difficulty score can range between 0 to 40. And in our sample, we saw that the distribution of total difficulty score in these children ranged from 0 to 25, and it is also right skewed. This indicates that since we sample these children from a general population, they are generally quite mentally healthy. The mixed effects part of these models can account for clustering, such that children coming from the same schools may share similar characteristics that this part of the models can account for. These models can also control for covariates, especially the confounders, and therefore better isolate our relationship of interest. And finally, the Bayesian part of these models can offer a more natural and nuanced interpretation to quantitative study findings, which I will be happy to illustrate at a later slide. So after all this technical work, I found that in this context, where children are exposed to pretty warm temperatures with an average of 24 to 29 degrees Celsius, higher temperatures were associated with more mental health related difficulties. But the estimates are quite imprecise, such that the uncertainty intervals as shown as the bar there are quite wide, and they cross the null association vertical line. But while these estimates were quite imprecise, with the help of the Bayesian approach, I was able to look at the area under the curve so that we see the probability of higher outdoor temperature being any risk to child mental health related difficulties was about 68%, way outweighing there being no risk or any benefits. How about for other child mental health outcomes? We see that externalizing problems primarily drove the observed associations between outdoor temperature and total difficulty score, as the estimates for externalizing problems are similar to those for total difficulties score. Lastly, I also explored whether effects could differ by school type and found that children attending public schools were more vulnerable to the effects of outdoor temperatures than those who attend private schools. Overall, this study provides some initial insights on heat and child mental health in sub-Saharan Africa, where we know very little about this particular topic. It also leveraged a comprehensive and detailed set of data to yield these insights. But it's also important to acknowledge that there is a mismatch in this study between the recall period we used of 6 months for child mental health assessments versus the 1 month window for exposure estimates. We're currently in the process of redressing that through building a spatial temporal model that would allow us to look at temperatures further back in time. We also cannot be certain about the associations due to wide uncertainty intervals and other inherent study limitations, notably residual confounding, in which there might have been other factors that we didn't measure and therefore couldn't account for that might have explained or partially explained the associations that we observed. But altogether, this study provides some initial evidence that the mental health of children, especially those attending public schools, may be at risk to higher outdoor temperatures. And this study is setting the way for much needed longitudinal studies in which we would follow the same kids over time in order to better establish the causal relationship between temperature and child mental health, and therefore see if we can confirm these findings. I would like to thank the many people and institutions, notably McGill and CIHR, that made me here today and presenting this work possible.